I don't know. Okay, this is John Bean here with Dr. William Nields, medical doctor here in Jacksonville, Wise Council member, full of wisdom, practical guy, sees a lot of different patients. He's worked in prisons, worked in hospitals and nursing homes type of environment, has a private practice, and sees a lot of different cases. So what we're asking for, Will, is for you to give your feedback and comments to the Wise Council member about the COVID virus, where it is, where it's going, and what your view of it is, because there's a lot of controversy, pro and con about it, and whether we're being a little misled by the government or the media, or whether we're being told the truth. So what are some of your perspectives and experiences on all of this?
Well, I think there are clearly people that are trying to mislead us out there. And I start with that because I honestly, I feel like the rug's been pulled out from underneath me with information. I don't know who to believe anymore or what to believe. One of the pinnacle medical journals, The Lancet, which is, I think, the oldest medical journal, a British publication, it is highly esteemed as to be a rigorous journal that will look at papers with scrutiny, was busted for publishing false data that seemed to be a political narrative. And this is the hydroxychloroquine trial. It was a hit piece on hydroxychloroquine, and it was totally fabricated. And why they would do that is bewildering. So with that said, it's like you don't know what to believe anymore. I'm trying to keep an open mind and, I have my own personal political biases, and I'm trying to keep that out of it and understand and just try to look at as much data as you can collect and draw your own inferences. So what I believe is that this virus is a bad situation. I hate it. I wish it didn't present itself this year. But I also think that it's being overhyped a little bit, probably for political reasons. In my opinion, for political reasons. It's an election year, and both parties have things to win and lose from this, and I think there's enough blame to go around. So with that said, I don't pay attention to the mainstream media, so I have no idea what they're saying. I hear that they're promulgating a lot of very negative information. So on the flip side, the sources of information that I look at, which are different scientists that are looking at COVID, especially in Europe, I'm hearing a lot of positive information, American scientists as well. So in the big picture, I'm feeling more hopeful over the past week than I have been previously. So John, I don't know where you want me to start. The coronavirus is a virus that causes the common cold. This is supposed to be a novel coronavirus or a new coronavirus, and it is a virus that has jumped species, so therefore can spread rapidly because there's not much human resistance to it. And it turns out that, and this is the studies that I've been hearing about more this past week or two, that there is about 20% of the population that seems to be immune to this, and possibly so. Right off the bat, many people are estimating 20% have what's called a T-cell immunity. And these are not antibodies, and it's difficult to test for. We have research tools to test for this type of immunity, but there are ways to do it, but we don't clinically use that test. In essence, they're finding in studies that 20% of people won't ever get sick from this because they remember the old coronaviruses, and their immune response is able to respond to this coronavirus effectively. So they don't ever get sick. So you take 20% of the population that already has an immunity to it, that brings us a lot closer to where we're trying to get, which is herd immunity. Okay.
Herd immunity meaning everybody's immune, or what does that mean, herd immunity?
Herd immunity means there's enough people immune that we don't see rapid spread of the virus. So if we go back to the beginning of this pandemic, I guess, December, January in China, the hospitals were getting overwhelmed. Are reported, again, you can't know for sure, but the Italy became overwhelmed. There were reports coming out of Italy that, I think this was now coming into January, that they were turning away stroke and heart attack victims from the hospitals because they were so full of COVID patients. That COVID patients were sicker. They would take a long time to heal. They are clogging up the ICUs and therefore overwhelming the hospital system. So with that said, the United States decided to do an economic suicide, really shut down the economy, and to try to protect the hospital systems was made sense to everybody at that time. And we did that, and it affected the viral spread, right? So we saw cases go down, and states started to open back up. And now we're seeing that the virus is making its rounds. Okay, we're seeing a lot of increased infection, mainly if you look at the statistical preponderance, it's younger people. Okay, so younger people are out and about, and they're for whatever reason they're getting infected more, at least, or they're getting tested more. But we're seeing a lot of young people getting infected. And the good news about that is that young people have an extremely low risk of, we'll say, start with mortality. That's a measurable outcome. So if you look at school-age children, the risk of, there's 230 deaths or less in the country of 350 million people of school age all the way through college kids that have died from this. Okay, that's a 1.25 million risk of death. That's not on our radar.
Yeah.
Okay. But for reference, your lifetime risk of death as a pedestrian getting hit by a car is about 1 in 500.
Mm-hmm.
So for a school-age child all the way through college, or 0 to 24 years old, your risk of mortality from this is 1.25 million. Now there may be risks of chronic infections and fatigue and other things, but we don't know those things yet. So when you go up the age category, the risk gets higher. So what about the next group that is 25 to say 44? They're at about a 1 in 16,700 death rate. So every close to 17,000 people in that age group that get infected, there will be one death. Most people can live with that kind of risk.
Right.
So that's talking up to 45. Now you look into the age group that's 45 to 64. And you're looking at a 1 in 2,500 death rate. So of every 2,500 people that get infected, you might have one death. So, and there's a lot of variability. So if you're a very healthy person that's out jogging and eating your vegetables and so forth, and you're not overly stressed out, you're sleeping, and you're healthy, your body is in a good physiologic state, your risk is less than 1 in 2,500. Now, if you're not sleeping and your immune system is compromised, if you're, eating a poor diet, if you don't have that physical resilience, then your risk may be higher. And so that brings in a very important point, that how we treat our bodies is extremely crucial to how we're going to respond to threats in the environment. And this is nothing new. Okay, there are some people that get very, very sick with the flu, and there are other people that seem to tolerate it better and recover better. They're less risk. And much of that is impacted by their personal, you can call it hygiene. Back in the 20s and 30s, they called it hygienic medicine, but it was nothing more than lifestyle medicine. So
the immune system has got a lot to do with all of this, right? So you're saying eating a healthy diet and exercise and less stressed, or even turning it over to God, is going to give you a stronger immune system, right? And gives you more of a protection from this and even the flu and other things like it, right?
Absolutely. That's one of the biggest take-home messages that, if I was the head of the CDC, I would be hammering this. I would be educating the public on the chemistry that happens when you eat a cheeseburger and a milkshake, what happens in your body, how that basically primes up your inflammatory responses. And so you're making yourself like a drought-ridden California forest, and the first lightning bolt that comes off, first COVID lightning bolt, you're going to go up in flames. And that's what happens with COVID. The immune system explodes, and it over responds, and it creates destruction. It's friendly fire in a way. So we want our immune system and our inflammatory cascades, all these chemical reactions that are happening in our body to be calm and quenched. So sort of more like a rainforest, you know, lightning bolt hits in the rainforest and a very healthy person, it's not going to cause as much of a problem. So I see that clinically. I have patients that are very, very healthy and health conscious and they do very well. And I have patients that are less so and they really struggle. And I've seen that through my whole career.
So a lot of your advice is about diet then and all these other factors, or do you give them vitamins or you give them drugs, or what are you encouraging people to do?
Well, so vitamins are supplements to make up for things that may be in deficit. Okay. So the biggest piece of the puzzle is the foundation, which is your lifestyle. So, diet, exercise or activity, physical fitness, the ability to do physical tasks, physical fitness, your stress levels. Okay. If you're under chronic stress and in a stress state, it's very toxic to the body. Lack of sleep comes from that, is associated with that, but lack of sleep is very toxic. And then, loneliness, a lot of things, unforgiveness, all these things have been tied into bad physiology in the body. So yes, the lifestyle factors, if you're interested in that, I recommend a book called The Blue Zones, which is simply an analysis of the people that live the longest in the world and what do they have in common. So what's the factors that impact your longevity? It's the fountain of youth. So that's the Blue Zones.
Okay. So
if you have, and what's really good about this, John, and this is why this would be my message if I were the head of the CDC, is because it doesn't take long to change your physiology. Okay. If I put somebody on a really strict regimen, let's say I can control everything that they eat, they can come to the boot camp and I can put them through an appropriate exercise regimen, I can turn their chemistry around in a couple of weeks.
Okay.
I can measure it in their blood to prove it. So you may not be able to lose a lot of significant weight in 2 weeks, but the chemistry, the physical machinery of your body will change in a pretty short period of time when you start giving the body what it needs and what it thrives on. So I'm very hopeful. This is all new and we don't have, unfortunately, good scientific explanation of this, but I can tell you what I've been seeing for years in my clinic. When we work with people in their lifestyle, they feel better in a couple of weeks and the blood markers change. 2, 3, 4 weeks, you see a difference.
Right. Okay, good. So you see that the media, and you haven't watched it, and I'm sick of watching it too. So it's all about the number of cases. I think that Trump said there's 50 million testings that have been done, in the United States, way above everybody else, of course. But the media is hyping in every publication or whatever. It's more testing, more test cases, positive tests. Okay, you know what I mean. And it seems like to me, and correct me if I'm wrong, that the hospitals, because they didn't have the flux that they expected or were predicted, is out marketing itself, or their agents are, you might say, to do more testing to find somebody or find people. And I've been told, I don't know if it's true or not, that the CDC actually changed the criteria about what is a case. Have you heard any of that, or know any of that kind of research, or what?
Well, I know this. In June, they changed the definition of a COVID mortality to include probable cases.
Okay.
And probable has some pretty loose criteria. Okay. So a probable case, and they did the same thing for counting a case in April. Okay. What they said is that if you have 2 symptoms and are from a hot zone or a case in a place where there's sustained transmission, which could be, it's definitely Florida, okay, definitely Jacksonville, then you could be counted as a COVID case or a COVID death. So what type of symptoms are we talking about? If I pick the lowest bar, it would be things like sore throat and a headache, or sore throat and fatigue. these are very, what we call in medicine, non-specific symptoms. If somebody comes to me with sore throat and fatigue, there's about 20 million things. Well, I don't know. There's literally 7 or 8 things that pop into my brain that I'm thinking about right away.
Sure.
Okay. That's non-specific. It could be many things. So it would be very poor medicine to pin it on one diagnosis without sort of doing diligence. So they opened up the criteria, which is going to expand the numbers.
Yeah. Okay.
And we saw, I noticed, well, I did follow this a little bit. There was stories in Texas, and the Texas numbers were being conflated this way. Specifically, Texas adopted that, and there were people exposing that they were exaggerating their case numbers this way.
Uh-huh. Okay.
So there's a lot of problem with the data. Okay, you have, I think people are cheating the data. You have people in the medical system that are incentivized to find COVID cases. So if you have a COVID case, you're going to get paid more,
Yeah.
right?
Yeah.
So these hospitals, they were forced to shut down their mainstream of revenue with procedures and surgeries, and so they.
Your sound is gone. Sound is gone. No sound. Okay. All right.
Can you hear me?
Now I can hear you. Yes. Sorry.
Okay. So in any event, you have financial incentives, then you have probable political incentives. Okay.
Yeah.
It's an election year. And I think most people understand that people are going to try to manipulate things to get their political will, whatever side of the aisle you're on. So there's a whole lot of things. So that's what I started with. I don't know where we're at. I don't know what to stand on. I mean, when the preeminent medical journal, The Lancet, gets caught in a third grade attempt at publishing, a hit piece, it just rocks my whole faith in much of the things that I count on.
Yeah. Like nobody's fully honest anymore. Huh? Is that it?
Very much so.
Yeah. Okay. All right. Well, thank you very much. This is very informative, good insight with your patients. Have you seen a lot of these cases at all or not?
Well, not many. I mean, I've had a few cases. I had, some in the first wave, I had 3 or 4 patients that came to me. All of them survived. A couple people that were, physically in bad position to begin with. Very interesting, actually. They had all the diagnoses that you worry about. They were believers. They survived, but they were having a lot of fatigue and just had really struggling. There was another guy, 78-year-old guy, who had a history of heart surgery, coronary artery disease. He had all the risk. He had that big risk factor, and he was chomping at the bit to get back to street preaching. And he came to see me because they wouldn't let him out of quarantine because his test kept coming back positive, but he was totally asymptomatic. And 78-year-old guy with heart disease. So it just was fascinating, and then more recently, I've had asymptomatic young people, and it's a real hassle for the workplace. What do we do with these cases? Yeah. You got to quarantine somebody for 10 days. Now, are we going to contact trace everywhere that they've been, and all the privacy issues and everything that comes with that, and for what? And then they go out and they get exposed to another case. Now they got to go back in for 10 days, and how that affects employers trying to keep a business running. It's really a difficult situation that I think we've gotten ourselves into.
All right. Well, somehow God will turn this into good. Somehow, there'll be good things will come from this. I hope so.
Well, I'm hoping for this T-cell immunity to really be what these scientists think it is, but they're predicting the southern states surge that we're seeing right now will be over in 4 weeks. So let's cross our fingers and maybe we see the transmission stop in a month or so.
Okay. All right. Well, thank you very much for taking the time. Really appreciate it. And I will see you soon. See you next week. Here.
Okay, John.
Thanks.
Yep.
God bless. Appreciate it. Bye-bye.
You too. Bye-bye.
Bye.